Howdy friends, your City Manager Seth Sumner here with your daily COVID-19 update. Today marks the 46th day since we first began reporting to you on video here on our Facebook page about this pandemic that has swept the globe. Today is Thursday, April 30th, 2020, and I wanted to start by showing you a new dashboard that you can access on tn.gov that has been established by the Governor's Unified Command. And so this has not been entirely updated for today's data, so we still will go to the Department of Health's page to update you on where we are across the state and in Tennessee. I do not have a guest on the update today, but we will be going over some other announcements, some that have been much anticipated here in our own community and across Tennessee. So here we can look at the confirmed cases and fatalities being updated through yesterday. You have a map of the state of Tennessee where you can individually click on these counties and get those numbers. And you can see also a listing of the most confirmed cases across the state of Tennessee by county ranked here on the side. So that is a new data set or a new way of looking at our data set from the Tennessee Department of Health that Unified Command is using to make measured decisions, to analyze the data that is being produced through the Department of Health and other departments to give our leadership a good picture of what's happening here on the ground so they can make good decisions on our behalf in Nashville. We will turn over to the Department of Health dashboard and I will show you 10,735 cases today. That is since the beginning of the pandemic, and a lot of these we'll see here, 5,338 are fully recovered. So we're sitting at still just about that 50% mark as far as those who have recovered and those who are still exhibiting symptoms from COVID-19. Now this is another big increase that we really don't like seeing happening right now after we were looking at models that showed the surge week was 2 weeks ago. I'm afraid that this may be showing our surge is delayed and may actually be occurring right now this week. 369 new cases in one day here across the state of Tennessee. Good number, 198 Tennesseans have recovered. We are so sad and we mourn the loss of our friends, our neighbors, our family who have been adversely affected by this novel coronavirus across Tennessee, including at least 2 McMinn Countyans now, 199 total deaths, 4 since yesterday. 1,045 Tennesseans hospitalized. There are 32 Tennesseans now using hospital beds today that were not using them yesterday. That is an increase of 32. Now, a number that we continue to want to urge you and everyone else that wants to, whether you have the symptoms or not, please get tested. That is a drive-through test, Monday through Friday, 9 a.m. until noon at the McMinn County Health Department. Drive up, you briefly fill out a little bit of information, they swab your nasal cavity, and you're off. And typically those results are coming back now in about 2 days, which is good. That keeps getting quicker and quicker, and we need that data. We need to know who is carrying COVID and who is not. 177,626 tested so far. That is an increase of over 9,000 Tennesseans in one day being tested for COVID-19. So that is very important. That is a number that we want to see continue to increase so we can be certain of who has been infected with COVID-19 and who is not. So we can make sure to isolate, quarantine those who are carrying the virus so it can prevent it from spreading to the rest of the population. Let's go down to the county level now. Here we have McMinn County. It is still showing just the one death. However, we have confirmed yesterday there are actually two deaths yesterday. And I have not heard today whether there have been any more, and I certainly hope there has not. There have been 5 fully recovered McMinn Countyans who have contracted COVID-19, and 92 total. That is a slight increase over yesterday. We were at 89 yesterday, 92 today. 3 more McMinn Countyans being diagnosed. But look at this number, 1,270 tests conducted. I did some quick math earlier today. I was looking at the comparison I made yesterday between Hamilton County, which has a population of over 350,000 people, whereas McMinn County has a population of 55,000. A big difference in those counties, but what about the testing level? What percentage of the population is actually being tested to make sure whether they have it or they don't? Here in McMinn County, it's 1 in 55. 1 in 55 persons being tested, and you see in Hamilton County, 1 in 182 being tested. 1 in 182, 1 in 55. We continue to do a great job as Athenians and as McMinn Countyans on making sure that we're getting tested. That's the right move. Good job, folks. Keep that up, please. And if you can't get to a test site Monday through Friday, this Saturday, 9 a.m., starting at 9 a.m., going through noon, at Cleveland Middle School in Bradley County, Cleveland Middle School. If you'll go there, they're going to be conducting the free test, just like we had a couple Sundays ago here in Athens. There'll be a drive-through, a really quick drive-through test. We know that folks are spending only about a minute in the actual test procedures, and then they're off. So if you can't make it to the health department, you want to get that test. If you can't make it Monday through Friday, Saturday, go down to Bradley County, Cleveland Middle School. You can get tested there. An important number also to look at, this 92 infected, 5 recovered. What is that telling us? We know at Life Care Center there's a cluster, and we have had more positive tests come out of that center. Staff and residents, and the Department of Health is working directly with them. There may be some new resources coming from state and federal to help our nursing homes. I'll talk about that in just a second. But getting into these facilities and understanding what the data is showing us, 87 positive tests in that one facility. 87 minus 92 will give you 5. And I did a little inverse math there. 92 minus 87 will give you 5. And that's what we're seeing today. McMinn County is getting tested, and our general population is not showing positive returns on these COVID tests. Our general population is showing negative. That is wonderful. It is not existing in our general population. So when you go to the grocery store, still be careful. Still wear your mask. Wear eye protection if you can. Make sure that you are protecting your health and the health of others. This face mask, of course, is to keep me from, when I'm talking, if I have to sneeze, anything, any droplets from leaving my mouth or nose that may contain COVID-19 and could be picked up by somebody else. We're protecting other people because we love our neighbor. We love our friends. So if you have to go out, what our tests are generally showing right now are that in the population at large, COVID is not prevalent. That is a good thing, and we have to work to keep it that way. We're keeping our eyes on this cluster at Life Care, at our long-term care facility. We're going to keep very close watch on that. I told you how the city's responding to that, and we've been in contact with that facility to make sure that we're still here to serve them if they need it. But if they're requiring us to be present with a police or fire presence, let them know how our firefighters and police officers will be showing up. We'll show up at the door. One firefighter in full Tyvek gear will show up, make contact, and then be able to discern what our action needs to be from that point. So that we're making sure that we are protecting your health, our firefighter and police officers' health, and the health of the persons still at that facility. We appreciate that relationship, and we just want to make sure that we're helping our neighbors in need. The city is still here at your service, and I want to update you on a few other items before we close today. Today, Governor Bill Lee is at the White House, just left a press conference with President Donald Trump where the President was making a proclamation in celebration of Older Americans Month. And in that, a large portion of that commentary was about how affected our elderly population is with COVID-19. We know that they are affected at a greater amount than the general population or from younger folks. And so we have to be extra cautious with that particular population and that age group, because we know that. We are in mourning for the loss of Tennesseans, Americans, and people all over the globe right now that have lost their lives to COVID-19. We are mourning the loss of 2 of our friends right here in McMinn County yesterday. Lifting those families up, we're with you. Call on us, call on your friends, call on your neighbors if we can be of service or of comfort to you during these times. As we know, here especially locally, nursing homes, long-term care facilities have been hit especially hard with this novel coronavirus. Our seniors are at an increased risk. Our elderly population are even more so. And that is why our governor has making a point to increase testing at all of those facilities. There are about 700 nursing home facilities across the state of Tennessee, and there is now an emphasis to get into those facilities with testing and check that population especially, so we know what we're dealing with, because we're learning a hard lesson here in McMinn County right now. There are about 70,000 seniors in those facilities here in Tennessee alone, and we're doing our best to protect that population. There are some things that I know the community, our small businesses, a lot of folks that are employed. There are, and if you don't know, that in our close contact businesses, there are 38,000 Tennesseans employed in that sector that was closed by an executive order several weeks ago, and we're now thankfully looking for a measured, very careful and cautious approach to reopening those businesses. Governor announced he's going to allow that to happen in these 89 counties. That is us here in Athens. It's going to be reopened May 6th with certain protocols and safety measures in place. Executive Order 31 also came out yesterday, and that is allowing non-emergency dental procedures. So that includes your dental cleanings you get every 6 months. All of those kind of dental procedures that are needed are going to be allowed. Now that has been pushed back to May 6th. So our dentist office under certain guidelines, being very cautious and protective of the staff and their patients' health, will be able to open up if they choose, starting May 6th. So the Athens Economic Recovery Team is at work right now starting to put these things together. So we'll roll out a new helpful graphic to let our population know, let our friends out there watching right now, so you know and you can share part of this next phase of reopening the economy safely in a measured, cautious approach as we're ordered to do so by Governor Bill Lee. And so we're working on that. We expect to have that new graphic out to you tomorrow. So be on the lookout for that, folks. May 6th is what we're looking at in this measured reopening of dental facilities and close contact workers. So let's look at the guidelines that have been rolled out for our close contact businesses. You see here, let me get my clicker rolling. If it'll work with me. Close contact business guidelines, right here, tn.gov, under the Governor's tab and the COVID-19 section, you'll find all of these materials. But if you own a close contact business that has been closed by executive order, that was one of those that was specifically listed, you may open, if you so desire, beginning May 6th. And so look forward to that next week. But here's the guidelines for your business. Now everybody else, we're customers. We get our hair cut. You might get your nails done. You might get enjoy a massage every now and then. You might be waiting for that COVID-19 tattoo. Whatever those things are where you're waiting on these businesses to reopen, you're a customer, you've got to know what's expected of us too, right? Not only the business owners and the staff, but the customers. All of us share a responsibility during this time to protect our health and the health of others. It is our duty as a citizen in our community and in this great nation to be responsible, to utilize proper hygiene, to go above and beyond to make sure that I'm not the cause of somebody else catching COVID-19 and becoming sick or even dying. We have to protect our health. Without it, we have nothing. So what do these guidelines tell us? I'll just quickly go over, but I do emphasize, go on here and check for yourself, read through these. We are still doing our best to maintain a safe distance. And I know that's hard in some of these positions, but we will do our best to maintain a safe distance. Employee protection. Screen employees when they report to work. You're going to check temperature. You're going to ask them certain questions. Right here's your guidelines, folks. If you're the business owner, if you're the manager, you're got your employees showing up to work, this is what you're going to do. Check the temperature. We just talked about that. Minimum temperatures can be taken and logged before arrival. So they don't have to get there and then get their temperature. They're responsible people too. They're going to take their temperature before they leave the house and report to you what that temperature is. It's safe. I don't exceed 100.4 degrees Fahrenheit, and I haven't for the last few days. Let's make sure that there's not a history. You didn't just break a fever that morning and then go into work. Make sure that you have fully recovered if you have had a fever, even if it's for something else, the common cold. We have allergies, and sometimes that may cause a fever. Whatever it is, make sure we're past that. There's no question whatsoever. We're being safe. Social distancing to the greatest extent possible. Employees should increase hygiene practices. Increase how often you're washing hands. You're wiping down the chairs, the chair arms, wiping down surfaces. You're doing all of that with an approved cleaner that says that it will kill COVID-19. And you can buy that cleaner. That it's actually manufactured right here in Athens by one of our manufacturers, Midlab. makes a cleaner that actually kills COVID-19. So it's possible right here in Athens that you can get everything you need to do that. Any employee feeling ill, don't come in. Don't stay at home, please. Direct any employee who exhibits COVID-19, get them to the Department of Health. Get them to their primary care physician. Make sure that they're seen about as quickly as possible if they're exhibiting those symptoms, and so we can get them tested and we can get them quarantined until those test results come back. And if it's negative, we'll still watch those symptoms. We will. If it's positive, then they'll remain under quarantine for a duration, and they'll be in contact with the Department of Health, who will then go into contact tracing with them to find out where they've been, who they've likely been in contact with, and then they'll be able to contact those folks and make sure they get tested. We got to put a lid on this pandemic, folks. Employers should provide training, education materials, and reinforcement. Keep that up. Make sure, hey, did you wash your hands before you touch that? Be that calm, gentle reminder that we are looking out for each other. I am my brother's keeper. Wear a cloth face covering. Does not have to be N95 or medical mask. It can be a simple homemade cloth face covering, but that is expected of not only the staff, not only the person giving the service, but also the customers. I'll show you that in just a second. So wear those cloth face coverings. All employees wash hands between serving each customer. Every customer. Wash those hands. Heightened sanitation, extensive signage. Talk about this. Let folks know this is what's expected. This is the new normal for now. Regular disinfectant of high-touch surface areas. Consumer protection. Do not offer any self-service food or beverages. So if you're getting your nails done, maybe you get a nice cold Coke with your nails. That's off limits right now. No self-serve food or beverages in these businesses when they reopen. No congregating. No folks standing around in a break room or at check-in counters or waiting rooms. Have your clients wait in their vehicle or outside at a safe distance, but no congregating in a waiting area at a check-in counter or in a break room. Make sure that folks are able to socially distance themselves safely. Customers should wear a cloth face covering. Services that require removing face coverings. If you get your beard trimmed at the barber shop, obviously that would be difficult to do with a face covering. Those activities are not permitted. They're not being permitted in this first phase of the close contact businesses reopening. May 6th, there's no beards being trimmed. Nothing that would require a customer to remove a face mask. And so that is explained right here. It talks about massages, things of that nature. It's all right here. Consumers and service providers have to know this stuff. Screen customers. So hey, I'm a customer. I showed up to get my hair trimmed. I'm going to be expected to answer some questions. Have I had a fever? Have I been in close contact with anybody COVID-19 positive? Expect, as a customer, to be asked and be ready to answer those honestly. Have you had a fever in the last 48 hours? So, where the governor is asking, these are guidelines for our business owners, you need to adapt your business practices somewhat, right? So we're going to limit the number of customers allowed in the premises to 50% of fire code capacity. So whatever that capacity rating for your business is, you cannot have more than half of that number in your building at any time. And that will help us, by limiting capacity, that will help us make sure that we're able to better socially distance. Services will be offered by appointment only, no walk-ins. Folks can't line up, walk in, get their hair cut, get massages, get tattoos. Appointments only. We've been under this guidance here at City Hall ourselves for the last several weeks. Appointments only. We're still here to serve you. We're still going to take care of business. Call us. We'll set it up. We'll make sure that you're being protected. Make appropriate physical modifications to accommodate for social distancing. If you have a waiting room and folks are prone to just come in and sit down, maybe you move the chairs. Maybe you stack the chairs up so folks can't use them. Make sure that we're not giving anything, just like I talked about with Dr. Miller yesterday. We're not wanting to be that temptation for someone else to do something that doesn't follow the guidelines or may allow a behavior that could spread this coronavirus. So, just like we closed the playgrounds, we're going to have to keep those closed just to keep folks from congregating there. Think about how you can rearrange, do some small things in your own business to make sure to prevent that congregating, preventing folks from getting too close. Do everything you can. Think this through. Prohibit the use of waiting areas. We've talked extensively about that just now. Businesses should remove all books, magazines, and shared materials. That's important. Maybe we're going to see our dentist. We pick up that magazine. We don't know who else has been there and picked that up, and whether they've washed their hands, whether they've got a fever. We don't know that. Take up the books, take up the magazines, take up those common materials, stash them away. Don't let that be a temptation. Thorough workstation and equipment disinfected. Again, clean, clean, clean. Enhanced sanitization of commonly touched surfaces. Everybody's got a counter. That's where you're going to, actually make the financial transaction. Folks like to touch that counter. You wipe it down after every customer. Be careful. Be cautious. We're taking care of each other's health here. Discard any single-use tools. Encourage touchless payment methods where possible. Instead of, if I've got cash, maybe I lay that down on the table and that stays there for a little while. Maybe they're able to get gloves and pick that up and let that be put away safely. Whatever you do, however you're most comfortable with taking care of this and making sure that germs are not being transmitted from person to person. This is up to you as the business owner and on us as the customer to do as much of this as we can and to do as much of it as we're comfortable with to protect health. Hand sanitizer stations, don't allow self-service. If you've got a tester of any sort, a perfume tester, those kind of things, put it away. Don't have those things out. Don't let people touch them. Daily deep cleaning. Use appropriate temperatures. Open windows and doors. Get good ventilation, fresh air going into your business. It's, I think, thankfully, going to warm back up in the next few days. It'll be good weather. Open a window. Let's get some good fresh air in there. Don't allow non-customer companions to accompany during the service. So I have to go get my hair cut. I'm not going to take my child with me if there's someone that can watch that child at home. I'm going to go by myself. I'm not going to take anybody else. I'm not going to put anybody else at risk. Don't allow group or communal settings. Plan for potential COVID-19 cases. What if we find out after the fact somebody had COVID-19 and they were there? What are you going to do? It might be smart to keep a log of all of your customers that so-and-so was here at this time on this day. Just a simple log like that. And if you're setting appointments, you likely have that anyway. But we could look, and if one of the customers is later identified as COVID-19, then we know everybody that was there after that person that could have been in contact. Note when you clean. note the time that you do a sanitization of those areas. So we know likely if only 2 people were there and then you sanitized, that likelihood of anyone past that being infected decreases quite a bit. So we want to make sure that we're being very thoughtful with this approach. And then this is for employers, making sure that your employees are aware of FMLA right now and the changes in response to COVID-19. So this is a measured reopening that our governor has declared for 89 of the 95 counties, and that affects us here locally. By his order, there are no local ordinances, there are no local orders, there's no local regulations that supersede this executive order and these guidelines. We're following it. We're asking you to follow it. And lastly, I did want to touch on unemployment. Unemployment continues to move up. There's more and more of our friends and neighbors who are being furloughed or laid off right now. So I know there's a lot of talk right now across the nation about unemployment benefits and taking care of these people in their darkest hour so that we can get back to rebooting the economy, getting folks back to work as we're past the threat of this pandemic, when we get that vaccine, when we get inoculated, whatever the case may be. And we're still going to be months away from that, folks. Months away from that. But we've got to be cautious. We've got to work together to protect each other's health. There are now 437,000 claims for unemployment in Tennessee. And what does that look like across our great nation? 30 million Americans. 30 million Americans out of work right now because of this blasted coronavirus. We're with you, folks. This is hard. This is not easy. But we've got to stay at home. We've got to do our part. We've got to stay apart still. We've got to use proper hygiene. We've got to use face masks. And we've got to be responsible at keeping track of this information in our own businesses. Keep those logs so that if there ends up being a COVID positive person later, that when the Department of Health contact tracing team calls, you've got the information. And it was only 2 people. We call them, and they've got no symptoms, and they've tested negative, then we've done our part, and we've protected folks. That's what we're asking. Do what's in your own best interest and in the interest of all people by protecting each other's health. And that's a big ask, to be responsible. Let's do our part by continuing to stay apart. And certainly continue to call on your senior and elderly friends who are most affected by COVID-19 right now. Call on them, text message them, and make sure they're okay. See if they need anything. Groceries, medicine, take care of those basic needs. I'll make that run for you. I'll leave it at your doorstep. I'll let you know it's there. I'll wave through the window, and I'm out. Don't come in contact. Make sure we're being safe. That's what this continues to be about. And even more so, now that Governor Lee is allowing some of our businesses to begin reopening. It's even more important now that we make sure that we've got those protocols in place, that we are wearing face masks, that we are being diligent about our hygiene, that we are limiting our trips and our possibilities for contact. Athenians, you have done an incredible job. I'm so proud of you. Let's keep it up. We're going to get through this together. And when we do, we're going to have a celebration unlike anything we've ever seen before. But we got to get there together. And we can only get there together, all of us together, if we're all doing our part. And we're all protecting each other's health. We're in this together. And we'll see the other side soon. May God bless you, and may God bless Athens.